So those first couple of days when COVID first started, it was filled with a lot of anxiety. Just even the facilities and making the rooms negative pressure.
I had to go get lunches because the lunch cart was not allowed in. The noise, the peppers, the hair, from all that air breaking off the hair and stuff.
You can't walk in to the unit unless you are physically and mentally prepared.
Initially people were very concerned about, what do we wear and how do we wash my hands and all these things. And now the focus is like, how do we best take care of this patient? And should we use this piece of evidence or this piece of evidence? And some of those initial concerns, it's just sort of melted away.
We got a little bit more comfortable once we had all 12 patients in our MICU were COVID patients and we knew what to expect. And I think our anxiety lessened a little bit just knowing that we had a set way to do things.
I sat down with one of the infectious disease people. We had lots of questions. And once she explained to me, I felt very confident that they knew what they were doing and that probably in many ways we were doing more than was necessary.
There's a lot less of, oh, we can't do this. I just don't hear that as much. I just kind of hear, we'll take care of it. We're going to handle this. We know how to do this now. And so I think it will, and I think it does now, sort of empower the entire staff and unit to feel confident and capable in taking care of some of the sickest patients in the country.
Since the beginning of COVID, we've all had to jump into action and just kind of deal with the situation at hand. And so this opened our eyes to so many opportunities and how we can really impact research as a whole. And MICU's been involved in a few of them.
If this drug trial make it anywhere, to know that we were a part of something this big, it's kind of nice.
And one of the reasons that many of us are here at Hopkins is because an educational environment is a fun place to be. There's people asking questions, there's curiosity. The rigor of investigation is unparalleled. I'll bring 2 residents, an intern, a fellow, the nurse, everybody to the bedside. And so what I tell the patients is, and what that means is that there are so many people thinking about how to make you better from this. Like, what's wrong with you and how do we get you better? And not just from giving you the right medication, all the way from the physical therapist, the occupational therapist.
It doesn't matter what your role is in healthcare. In the thick of it, we needed every single person, from EVS to respiratory, to the providers, to nursing, to the social workers. Everybody played such a critical role and it's still doing that. And I think we just function better as a team.
We have had some amazing success stories, patients that I thought there's no way. And they defied everything and survived. There's a picture of me standing in front of a room and I have my PAPR hood on and my scrubs and I have my arms in the air. Like, yes, I can't even believe that this man is off the ventilator.
You can feel it when you walk in that there is that level of respect and support that, without a doubt, it's like the unspoken rule. You walk in, they know what needs to happen, and it just gets done. And, that comes with time, but also with experience. And that's what our ICU nurses are like that here.
Being a nurse during this time, it's a big deal. It makes you feel proud of the work that you do.
We were there every day. I was just happy to be there because everybody else was going to be there.
The sun will always rise. Those patients will still be there and the care has to continue. So we keep going. I don't want to work anywhere else. That MICU is home to me. And those people are my family.